Good morning, and thank you for joining the webinar of the AI Innovation Center and Brainport Development on MedTech. Today we're going to present you use cases in the field of MedTech and artificial intelligence, the impact. We have a diverse set of speakers who would introduce you about how to apply artificial intelligence as part of medical technology and yield the benefit of this real modern technology into the field. Today we will co-present with Quirine Verstappen and myself, Sebastian Larijse, this event on MedTech. Quirine will take over, introduce the speakers further and the program of today and the further sessions.
Thank you, Sebastian. My name is Quirine Verstappen. I'm program manager at Brainport Development. And you might know Brainport Eindhoven as the home of pioneers. You might have seen this on a PSV match coming by. But Brainport Eindhoven is also the home of MedTech pioneers. The power of the ecosystem is our strong high-tech manufacturing industry in combination with our unique cooperative model. We develop smart health solutions for worldwide use and use our technological competences for transition in healthcare. In Brabant only, there are over 300 MedTech companies situated. And we as Brainport Development and also the AI Innovation Center develop different activities for MedTech companies in the Brainport region. As I said, Brainport Development has different activities for MedTech companies in Brainport. So the first one are the key enabling technologies for digital transition, and the sessions we are organizing today are part of this goal. In collaboration with the AI Innovation Center, we organize 4 webinars or online meetings about the adoption of AI for MedTech companies. We do this from the AI of Brainport, which is part of the Dutch AI Coalition. Next to that, we also organize Innovation Meets Hospital sessions, which are pitch sessions for startups and SMEs to pitch their innovation for regional hospitals. There's always room for more pitches, so please let me know if you want to pitch your proposition for the hospitals, and we get in touch. The main goal of this is to connect the world of startups in MedTech with the world of hospitals. The third is international business development. We enable companies to be more effective, not only in international markets, but also in regional markets, and we stimulate them to grow more. And last but not least, we want to increase the joint visibility of Brainport as a MedTech hub. So not only position it as a high-tech hub, but also as a MedTech hub worldwide. All these activities are a result of the discussions we've had with MedTech companies in Brainport, so please let us know what you're working on so we can develop more activities like this. As Sebastian already said, we are organizing 4 AI innovation sessions this year. Of course, we start today with this webinar about the potential of AI, and several speakers will inspire you with the MedTech cases today. The second meeting will be on March 8th. Then Kees van der Klauw from the MedTech and Dutch AI Coalition will tell you more about data and the platform. And Jeroen de Mas from the Geronimus Academy of Data Science will also join us. The third meeting will be in April and will be about more how to inspire you to really get into the action mode. And we end up in June with the matchmaking finale between the AI developers and the MedTech community. We were really looking forward to meet you here in the conference center of the high-tech campus, but unfortunately, due to the rising corona numbers, we are doing this online. But of course, we would like to meet you in one of these meetings later on this year. So let's get started with the keynote speakers, and hopefully you will be inspired today.
Thanks, Quirine.
If you have any questions, suggestions, please let me know in the chat, and we can get in contact later.
Thanks, Quirine. I really appreciate your input. What you demonstrate here today is that we have a full ecosystem of players who are searching for the best delivery of value by collaboration, and this session is really about how we bring the best parties together on delivering value. I would like to introduce Martijn van Grieken, who will come on the podium, who will present his story about personalized drug delivery and diagnostic, and he is the director of data science at Gimmicks. Martijn.
Thank you. I hope everybody can hear me. I definitely can hear myself. Well, thanks that I can be here. Today I'll give a bit of a speed date session, so if it goes a little bit too quick here and there, please feel free to contact me afterwards. I'll give you a rundown on the main topic is personalized drug delivery and diagnostics, but I'll give a little bit of examples of projects that we're involved in at the moment. All right, so the name of my talk is AI for Life, Personalized Medicine using Artificial Intelligence. A little bit about gimmicks. I'm one of the co-founders. We started in 2014. We have about 25 FTE at the moment. We have expertise in data science, such as mathematical optimization, statistical analysis, machine learning, deep learning, genetic algorithms, and a vast experience in healthcare, specifically medical diagnostics, predicting treatment and adherence, and personalized care. And I'll give you a few examples of projects that we have done in the past. So we have two offices, one at the central station in Eindhoven at the Kennedy Toren, and our second one is at the AI Innovation Center here on campus. We're part of the Dutch AI Coalition and Tech Delta, and, oh, I'm going too quick. And we work according to the international standards ISO 27001, 9001, and specifically for the healthcare system, this is an important one, 13485, which is the quality management system for healthcare applications. So we assist or we support our clients in answering the questions following the regulations from the European Medical Device Registration and the Food and Drug Authority of the United States. When I talk about artificial intelligence, I'm talking about the intelligence with which machines independently solve problems. They imitate the human mind. And it's important to state that the AI projects that I'm talking about here, but most of the projects that you will hear about are narrow AI. So these are intelligent computer systems that can solve problems, but one problem, one specific task, and they do that very well. So they're not generic, they are very specific. Is artificial intelligence new? No, it started in the 50s, but the intelligence was rule-based back then. Over time, in the 70s, 80s, we came to statistical intelligence, where machine learning found its way, and we are now in the age of deep learning, where neural nets base the intelligence. All right, I'll tell you a little bit more about that. I'll go pretty quickly, because I think most of the people at home know about deep learning. But it's mimicking the neural processes in the human brain. So here you see an image of a neuron in our brain, and if I give it a bit of more schematically presentation, you have the dendrites and the synapse. The synapse, this is where the information enters, and it gets processed in the nucleus. It goes through the axon, and then via the dendrites to the synapse of the next neuron. And this process is intelligence and it's learning. And this is the key. So if I go to the neural network presented here, in the middle you see a lot of neurons. This could be up to thousands of neurons, and this is a mathematical representation of our brain. And the beauty is that we don't have to provide rules for this neural network, but the neural network can learn by itself. It will learn by example, learn by data. So for instance, this is an image of a fundus image of an eyeball, and there is a disease there. So if we train the network with thousands of examples of healthy eyes, age-related macular degeneration, DRE of Drusen, then over time, over learning, the network will understand which is a healthy eye and which has a disease. So for instance, after training the network and we present the network with a new fundus image, it can identify that it's age-related macular degeneration. I'll give a bit more example of that later. So neural nets, deep learning, very capable of dealing with a large data diversity, structured and unstructured. Structured is more like tables, and unstructured is images, video, etc. A few quick examples: imaging, medical diagnostics, video recognizing behavior, sound recognizing emotion, text and speech, sentiment analysis, very complex task, and time series recognizing abnormalities. And this is often what we see in our watches. All right, I'll give you a few examples of AI projects that we as gimmicks have been involved in, starting with the eye example that I've mentioned earlier. So detecting eye diseases on fundus and OCT scans, which are made using this equipment. And it can be done in hospitals, but it can also be done at opticians. So what we do, we've developed a software package where we've trained a model that can recognize up to 35 different eye diseases. And by presenting the software with a picture of an eye, fundus, or an OCT scan, this is a fundus scan, by the way, then the model will recognize whether it's one of the 35 diseases. In this case, it's pretty certain it's age-related macular degeneration. So what are we showing here? This is interesting. This is the original picture going into the model. These are the trigger points that the model identifies as being important in the decision-making, and these are the two layers on top of each other. So this will give an extra set of transparency for the medical professional to be advised as to why the model is, or on what area the model is determining that this is age-related macular degeneration. So this is the same, but then for OCT scans, and here again, in the middle image, these are the trigger points from the model. We overlay it with the original fundus, and the decision can be made by the doctor. This is only supportive. This is decision support. Second project, monitoring fetal health during labor. What we can see here is the fetal heart rate. And here we can see the contractions, the womb contractions of the woman in labor. So what we want to identify is, can we find, using AI, can we find patterns in both signals that might suggest there's stress at the fetal level? So we look at a period over time, we look at the two patterns, and we translate these signals into mathematics to identify the patterns. At the moment, this is a very subjective matter in gynecology. The gynecologist is trained, he recognizes the patterns, and based on his experience and his education, he or she can decide whether there might be fetal stress. So we are objectifying this subjective way of interpreting both these signals. Third case, detecting and counting abnormal cells in pathology. This is a breast cancer biopt, and what we do in this software package, these are multiple models, by the way, that have been trained on different tasks. This is machine vision and machine learning. We identify the tumorous cells based on their characteristics, and then we can count these cells. So this is, again, this is a decision support. This is supporting the medical professionals. And by doing this very rapidly and securely, this really supports the professional, and it gives a lot of efficiency in doing his task. All right, back to a bit more advanced AI, the Legali MedRing as a platform, real-time diagnostics and personalized medicine. This is one of the projects that we're currently involved in. I'm very excited that Demcon is here as well, because the MedRing, the hardware is developed by Demcon, and the software and the platform and the intelligence is done by Gimmicks. So I'm excited to present this, and I'll give you a little introduction, or actually Legali will give you introduction because they can do it much faster and better than I can.
Of Legali is to revolutionize drug delivery and diagnostics for women. Our key components are utilizing the exceptional qualities of the vaginal root and digital technology. The vagina has a stunning dynamic blood flow. That makes the vaginal wall the perfect area for two-way traffic. One is the uptake of medication, and two is collecting biosignals from the body circulation. Legali has developed a vaginal ring. The Legali ring houses microelectronics and a drug reservoir coupled to a micropump. This allows programmed and personalized drug administration. The Legali ring can be equipped with a sensor for collecting diagnostic information. The ring transmits real-time wireless data to a smartphone or watch. The flexible ring is designed for comfort and convenience. The Legali ring is self-insertable and self-removable by the user. After insertion into the vagina, the ring expands itself and makes close contact to the vaginal wall without violating the tissue integrity. The drug delivery ring releases programmed medication, which rapidly reaches the blood circulation. Vaginal medication flows directly to the target organs. This in contrast to gastrointestinal intake, where medication first has to pass the liver. The smartphone registers the medication data for evaluation. The diagnostic ring can pick up and monitor in real time a diversity of body signals like glucose, or, for example, hormones, muscular activity, and drug levels. The ultimate Ligali ring offers the possibility of drug administration guided by diagnostic algorithms in closed loop. The advantages of this revolutionary system are numerous. Ligali iRing, the inside marvel in women's health.
All right, let's get into a little bit of detail as to where AI comes into place. So again, this is the ring, the MedRing as a platform. This is the terminology we use. You can see here the ring has an antenna, a CPU, a sensor, a battery, a medication reservoir, and a pump. So this is revolutionary hardware, and now we are connecting it to the software. So let's do that by showing the roadmap of Ligali. We probably know this is one of Gartner's, but there's more schemes. This is the hierarchical analytic methodologies framework. And we can see the different types of analytics, moving from descriptive to diagnostic, to predictive to prescriptive analytics, answering question, what happened, why did it happen, what will happen, and what will be the best situation, how can we make it happen. By moving up this hierarchy of analytics concepts, we increase value, but we also increase complexity. But this gives us a lot of insight, and this is used by Ligali to define their roadmap. So I'll take you a little bit further than that. We're moving from reactive to proactive to automation. This is important. I'll show you why. We're moving from hindsight, looking backwards, to insight to foresight, so trying to see into the future. The different analytics technologies, descriptive analytics, we show how the patient feels, and we can manually adjust the drug delivery scheme over time. So we've seen the drugs, how they can be delivered, and I'll get into that detail a little bit later as well. Diagnostic analytics show the relation between the drug delivery and the wellness of the patient. Next step, predictive analytics. So not only the relation is shown, but AI can advise on optimal drug delivery, so based on the insights that are provided by the patient and by the sensors. And prescriptive analytics, and this is into the future, where AI can automatically adjust optimal drug delivery. And that, again, based on manual and measured insights. And I'll go into detail. This is the schema, again, for the different components. So I'm sorry to walk in front of it, but then I can show you what I mean. So first step is that the ring will provide a dose of medication X to the patient. The patient will let, via an app, know what her wellness is, how she feels. This will be recorded in the Ligali platform, and via a dashboard, it will reach the doctor. So the doctor and the patient together can decide whether they want to change the schema and want to change the dose of the medication. Again, this is a project of multiple stakeholders. We provide the platform and the intelligence. Demcom provides the ring, and this is obviously a project by Ligali. All right, the next step, the diagnostic analytics, will be same flow. However, now the ring will provide information via the sensors about the patient, and it will provide it into the platform where AI can then recognize the relation between drug delivery, wellness, and the body measurements. Again, it's a manual process. The doctor and the patient together, they decide which schema is best, which dose is best. Next step, predictive analytics. AI can now advise on optimal drug delivery scheme based on manual and measured insights. So manual, how does the patient feel? Measured, what information comes via the sensors to the platform. AI will then still provide information, but also will provide information as to an advice on how the schema should be applied. And that goes straight back into the smartphone. And then the doctor and the patient can still decide. Step 4, which is into the future. Again, we have the information from the patient, how she feels after a dose. Information from the ring goes to the platform. And then AI can automatically adjust optimal drug delivery scheme based on manual and measured insights. So here we can see that the AI can hypothetically steer the behavior in the ring, giving the right dose at the right time with least amount of side effects for the patient and least amount of medication. I'll give you a hypothetical example. So the information that I'm going to show you now, it's just to give you an idea as to how it works. This is not true information, but I've provided it into a hypothetical situation. Step 1, we have a consistent level of pre-described dose of 5 milligrams of medication X. This is the wellness, based on how she feels, how the patient feels. She's good on Monday, Tuesday, Thursday, Saturday, a little bit less on Friday, and not too great on Wednesday and Sunday. The doctor and the patient, they talk together and they decide, let's increase, based on the information that they can see, both on the app and in the dashboard, let's increase the dose on Wednesday and Sunday because you're feeling worse then. All right, the dose was adjusted by the patient and or the doctor. Wellness improves slightly, and however, the total amount of medication increases by X. But now the third stream of information, this could be this could be temperature, pH levels, hormone levels, all kinds of information about the patient coming in via the ring. And AI recognizes a pattern between this information and the wellness, given the current dose. So now they can the doctor and the patient, they come together again, they look at the information and they say, let's decrease the dose on Monday, Tuesday, Thursday, and Saturday, and increase slightly on Friday. So if that is the case, based on the insights given by the AI, dose is adjusted according to the given body measurements by the patient and or the doctor. Wellness improves even more, and the measurements support the level of wellness. Right? Further than that, the amount of medication decreases, and this is something that we want to do, obviously. How can we further improve your wellness? For instance, by utilizing AI. And this is the fourth step. Based on the insights of the AI, given by the AI, the dose is adjusted according to the body measurements by the AI system. The total amount of medication drops even further, which is what we want. Wellness improves even further, and the doctor and the patient can now discuss, you're feeling well, we can keep monitoring your progress. Again, this is a hypothetical situation, but this is in the roadmap of Legali, using AI for personalized delivery. I'll give you a few screenshots of the app that we have at the moment. This is here, you can control your medication, you can set the timelines, you can set the amounts. Yeah, oh, too quick. Here you can adjust the schema and the amount of medication. This is where you let the app know how you feel about the medication, about the schema. You can add notes to it as well, and all this information comes into the platform. And here we can see the wellness of the patient. So, final sheet, the potential of the MedRing as a platform over time. So we have the MedRing as a product platform, so standardized components in the ring. Then we move to an innovation platform, where various partners can add components such as sensors, can add different drugs or medication to the MedRing. We move to a business platform where this platform can provide turnkey solutions for partners, and eventually the MedRing as a data analytics platform where we can generate value-added insights. Thank you very much. And I want to conclude, everybody who is into MedTech and is interested in MedTech and has kids or not, watch Big Hero 6. Really nice movie. Thank you.
Martijn, thank you. What I can imagine that we have a lot of questions for Martijn and the other speakers that are still upcoming. Please send them by the chat in YouTube. It would be great to use those chats and questions for the roundtable later on. I'm extremely impressed by this solution. I'm really looking into how this can contribute even further to human health and wealth, and looking forward to this ecosystem play that we have here together. So in a few moments we have a presentation about Koen from Autoschrijver, and I would like to invite you on stage. I will make a quick step backwards so that I can leave Martijn. Martijn, thank you. Looking forward to the roundtable. Koen, I will present history, and Koen, if you're ready.
Yeah, thanks, Sebastian. You had a couple of more slides, I think. Yes. Yeah, thanks for watching today from your homes. In one sentence, what we do is we try to reimagine the consultation between a patient and a doctor. My name is Koen Bonenkamp, and I'm one of the co-founders of Autoschrijver. So to start, try to imagine the last time you were at the GP or a doctor and how that conversation went. It's probably not like this. Your doctor was probably not that relaxed sitting on a skippy ball. And more likely, the doctor was half of the time behind the screen, taking notes of all the things you're saying. And even after you've left, the doctor kept typing and administrating. About 35% of the total consultation time is spent on administration. That's, first of all, a lot of money, making healthcare more expensive, but on the other hand, there's also a lot of pressure on the doctor itself. But it's very important work, because it's the kind of data that makes healthcare better. It helps getting you an accurate and timely diagnosis. One of the sad things of the way the systems are currently built is that there's a lot of clicks involved, and in the end, doctors still write most of the summary as a free text field. So if you explain a lot of details of your symptoms, the summary will probably be 2 lines where all the kind of details are lost, and it's definitely not captured as discrete data or structured data. So for example, symptoms and diagnosis separated. And that's the kind of data that AI loves, structured data. Because it's not captured as structured data, the average kind of consultation, 85% of the information that you just shared with your doctor is lost and can never be reused for kind of future diagnosis. So how do we reimagine this process? First of all, we don't do that alone because we work very closely with Leids Universitair Medisch Centrum. And this doctor, Martijn Bauer, he was the brainchild of what became Autoscriber. So he's the first doctor that said to his colleagues, let's start recording conversations and let's try to see if AI can actually do that note-taking for us. And that resulted in Autoscriber Flow. I think we've worked now for 2 years on it, and it's still kind of in beta, but it's functional. It's in beta because AI learns from data. So the more conversations we do, the better it's going to work. But how it works is that we have a microphone in the consultation room, and it can also be our mobile recording app that's in the App Store, or it's a microphone hooked up to the computer. And it in real time streams the whole conversation, so all the audio, to our AI platform, which transcribes it from speech to text, and then gets all the medical relevant information out. So for example, the word medication, stomach pain, it links stomach pain to that there's 3 days that you've experienced that. And all that kind of things are in a structured way presented to the doctor in their Chipsoft or HIX or Epic environment. Very importantly is that we also want to really give back to the patient. So, of course, the patient's going to benefit from better healthcare and hopefully lower healthcare costs, but also directly via replay, which is a functionality that once they are at home again, they can replay the whole audio conversation, and we make it easy for them to go to specific parts, for example, the medication prescription, and also share parts of the conversation with loved ones. So I guess especially elderly people, they're a lot bothered by their children that want to know exactly what was said by the doctor. They can then share part of the conversation with the family. The status, as I said, Flow is currently in beta. We have LUMC testing it, and we're onboarding 3 additional hospitals in the next months. But that's kind of the maximum capacity that we have, because there's a lot of manual annotation to kind of train the AI engine. But for replay, we are ready to onboard hospitals. So if you're watching and you know of a physician or a hospital that might be interested, then get in touch with us, please. To finish, the vision we would like to contribute to, and that's that we want to support a world where the doctor can completely focus on the patient. So they could, in theory, sit in a loungy kind of setting. They don't have to worry about administration, because that's being taken care of by AI. And very importantly, the AI also makes sure that there's just never a diagnosis missed. So if you said something in maybe 3 years ago to your GP that you went on holidays to a tropical country, that might be the kind of crucial piece of information to diagnose that you have a parasite or whatever. At the moment, that's lost. We help, that's our mission at least, that we want to make sure that that kind of information is leveraged in the future. Thanks for watching. If you have questions, contact us at hello@Autoscriber or pay us a visit here at the high-tech campus. Thanks.
Thanks, Koen, and I'm looking forward for your participation in the roundtable. I'm really glad to see how technology could augment our future health. However, for me, for the beginning, on stage David and Bas Vet from Demcon. David is the Business Unit Manager Artificial Intelligence, and Bas Vet is the Senior Mechatronic System Engineer. Take it from here, and I'm very curious on your addition to the story.
Thank you. Good morning. So today I will be presenting on behalf of Demcon with my colleague Bas 3 use cases related to MedTech that we worked on. Those will not be the Legali case. We already heard about that, and we are very happy that we can have a cooperation in this Brainport development area that we have here with respect to Legali. But we will present 3 different cases. One will be related to signal processing for respiratory support, one related to the performance of respiratory equipment, and the third one is related to a medical pump. But before I do that, a brief introduction related to Demcon. Demcon is now about 30 years old. We have a little bit over 800 employees located in 11 locations around the world. Founded by 2 people, Dennis and Peter, still heading the company today. We work in a variety of fields. Today we'll be talking about MedTech mainly, but we have a large set of our work in the high-tech systems, also in the field of water and maritime, so water quality control, but also boats. We work on space and also significantly in defense and security. When we work with algorithms, so with AI or machine learning as we call it, we mainly do that to add functionality to our systems, to improve performance, to automate certain tasks, or to reduce cost of ownership. And we generally do that by combining our expertise in mechatronic system design with, very crucially, domain expertise in the medical field that is very, very critical as well, with artificial intelligence or machine learning. And we focus on 2 specific areas within the field of machine learning. One is time series and control. We'll see an example of that later. And the second one is computer vision. So we try to limit our focus there as well. And what's important is we do this really to productize. So we rarely do feasibility studies only. As Demcon, we try to realize products also in the MedTech field that really finish up. In other words, we don't only do algorithm development or data analysis, we really productize, do edge deployment if required, and also the operation of these algorithms in the field later on. So let's go to the use cases very quickly. That's why we're here today. The first use case, and that's the only one I will be presenting, and after that we'll switch to Bas, is the case of respiratory support. So that's nothing new in days of COVID. Most of you will be familiar with the fact that we are heavily counting on respiratory support equipment on the ICUs for people to recover. Demcon has been in this field way before COVID already. We have been manufacturing blowers for ventilation equipment with Demcon Maccabi, originating from Dräger, as you can read here, acquired by Demcon in 2013. And we developed in 2020 our own ventilator system as a backup for the current existing commercial systems already. And 2 of the examples we will show today are related to that case. I should stress that these are all in development, so if you buy a respiratory equipment currently, these algorithms will not be in there yet. So the first case, and that's the one I will be presenting today, is related to signal analysis. So it's important to know as quickly as possible if a patient starts breathing by him or herself while being under respiratory support. And one way to do that is to measure the electrical activity in the epidermal, so in the midriff. And if you do that, one of the typical measurements you could get is the top graph here. And this, as you can see, is highly dominated by the heartbeat of the patient. And the question is, can you find from this measurement the actual respiratory activity going on, which is the blue line here, which is very high frequent electrical activity of the muscle tissue underneath the skin. And these graphs seem the same size, but there's about a 200 to 500 times reduction. So this breathing signal is actually in the top graph as well, which you really cannot see this. This is a signal processing challenge which you can address with traditional methods, obviously, filtering, time series processing, or a combination of both. We do that. That's why this arrow is green. That works. That's also part of our SEMG solution. And the other way is, could you do this with a deep learning technique, for example, LSTMs, as well? The first results indicate that this is possible. So the first results show that the deep learning network is able to recognize the respiratory activity from this top graph and tell us when a breath is starting, peaking, and ending. This is a challenge because the graph you see here is the perfect world. The patient isn't moving. There is no other kind of electroactivity going through the skin. Of course, there are way more difficult cases where the algorithm should still work. With the time in mind, I want to stop here with this example, switch to the last two examples, and Bas will do the presentation of those. So thank you very much, and enjoy the rest of the talks. It's over.
Thank you, David. Yeah, indeed. So the second case, also related to medical ventilators, is actually comes from a challenge in the respiratory system. So when you have a patient on the IC, it's fully sedated, that patient is fully supplied by air by the system, so the breathing is done by the system itself. But when the patient wakes up, it starts to have its own breathing impulse, and in that case the medical ventilator should not force air at the wrong moments, really should support the breath of the patient itself. Well, this works fine, so the system monitors the pressure and flow of the patient and has certain trigger levels. But not always this works fine, so in some edge cases something goes wrong, and you have patient-ventilator asynchrony. Of course, you can imagine for patient this is very tough to deal with. If you try to expire and the machine forces you to inspire, that is rough on a patient that's already weak as it is recovering from the IC. And actually, there's not a good detection method at present for that. So typically what happens in the ICs is that a doctor sees that the patient is recovering not as fast as he expected, and he has to go up to the bed and look at various monitors, heart rate, blood oxygen level, until he finds eventually a graph like this, including the pressure and the flow as measured by the medical ventilator. And when you look at this, so you see here the pressure and the flow, and this is a normal breath. So the doctor expects to see this, and the red line here shows the patient's own breathing impulse. So this is a good breath. If you look at the other one, here you see actually that the patient wants to breathe twice, and while the medical ventilator only gives one breath. There you have here you have asynchrony, and you actually see that the flow pattern is different. So doctor can recognize this from these kind of graphs, and our idea is, okay, why can we not make a machine learning algorithm that does the same? So that's what we did. We had a good model of this system, and generated a lot of data and trained an algorithm based on LSTMs on this. And basically, you can see the result here. This is a graph that shows the inspiration expiration delay. So everything outside of this box in the middle is asynchrony. So this is the regular breath. Our algorithm does 93% accuracy on this model data, so that's pretty good. Then we try to we are now incorporating this in the ventilator itself. So that's edge deployment to our embedded system. Of course, the next step is to go to experimental data. We already did this, and we show that we have 73% accuracy on that. And then you say, okay, this is lower than the model data, of course. But you have to realize that, in fact, this is a new functionality to begin with. So before, the doctor had no indication of asynchrony on beforehand, has to see it himself. Now he gets an alarm from us, and it has already 75% accuracy. So it's an added functionality that helps. And of course, we are working on improving the accuracy in real cases further by getting more actual patient data. Next slide. Yeah. The last case that we want to discuss is a case with medical pumps. And this is actually a complex system of valves and pistons, consisting of multiple valves and pistons. And the challenge here is to actually make a flow that is very constant with this system. You can imagine that if you have a system of valves and pistons, it's very non-linear and actually discontinuous. So it's actually hard on beforehand to make these moving parts work together in such a way that you get a very steady flow. Our engineers have worked on that, and they came up with a nice open loop trajectory of the various actuators to get a good flow, but still you see there is some spike on that behavior, especially when you close a valve. Near that moment, it is difficult to get really steady flow. So we designed reinforcement learning algorithm to tackle this challenge. So in reinforcement learning, we work with the model of our system. And we have an agent that actually acts on that system. So this model actually provides information about the flow and the situation of the actuators. And that's the observation that goes to the agent, and then the agent has to perform an action. So that means put the pistons and valves in the right position to get constant flow. And this is actually a system that learned from zero information. So at first, this agent has no knowledge of what to do, and it starts to do random things. And then from that behavior, we reinforce good behavior. So we give it a performance bonus when it does get steady flow. And then from that system, you can actually evolve and train this agent until you reach actually the graph that you see here. So it actually showed better performance after a number of training cycles than our original open loop reference trajectory. So here we show that we can actually first of all learn this behavior, so that means that we do not have to make this complicated thinking, have our engineers come up with a difficult trajectory for the actuators, but we can actually have a system just learn that behavior. And on the other hand, we show that even we can improve the performance of our human modeled trajectory. So that's our use cases. So you can see that as an AI integrator, we work on a number of use cases and actually show that we can either provide new functionality in the MedTech field or improve performance of existing technology. I hope you have questions. I look forward to the discussion.
For sure, I have questions myself about this mechatronics, mechanical engineering, and data science going forward. I also would like to invite you again to send your questions into the YouTube chat, as such we can ask them during the round table. I will ask Bas and David to leave at the left side of the podium. I'm going to invite Malou Giele from Fruit Punch, who's going to present her story around Fruit Punch and AI for health. Welkom Malou.
Snel gedaan. I decided to present the work of Fruit Punch I don't know if everybody was able to hear me. I hear there was a problem with the audio. So let me continue with this microphone. As I said, Fruitbench AI for Health wants to innovate the healthcare industry by teaching students to learn artificial intelligence and learn how to apply it for good causes in the healthcare. The strategy of Fruitbench AI for Health is to advance AI education first of all, because good solutions start with a good education. We want to unite different AI enthusiasts from different levels, because combining different perspectives also gives better solutions. And we want to make an innovative impact on healthcare. And how do we do this? We do this with mostly with our AI for Health challenges. I will give you first an example of a previous AI for Health challenge that we have done to aid in the COVID-19 diagnosis. An interdisciplinary team of 5 students worked on a project together with a health organization to solve a challenge that they currently had. It is a very tedious and time-consuming task for the radiologist to segment the lungs. And this is where artificial intelligence can help. So in this case, our students worked on an artificial intelligence model, a GAN model, that can automatically segment the lungs, which is therefore time-saving in the hospital care. And this is one of the many projects that we are setting up that follow this structure. We reach out to a healthcare organization and really define with them what a challenge is that they have involving data that could be solved with artificial intelligence. They provide us a data set and a project definition, and we recruit inside our community enthusiastic students that want to learn in a challenge-based way by gaining experience. We then stay in close contact with the healthcare organization through weekly or bi-weekly meetings to ensure that what we actually develop also will be useful to the healthcare organization. And these kind of projects are currently going on. We have 3 more projects. The first one is to predict deterioration. The deterioration of patients means that a patient needs to be transferred to the ICU or will soon have a not very good ending. So predicting this is very important, and we are doing that in one project at the moment. We're also working on hernia detection on X-rays. It's important that if you perform a surgery that the motion of the neck will actually improve. This can be automated, the detection of this improvement can be automated through artificial intelligence, which is what also a team of 15 students are working on currently. And AI for Health against sepsis. This is depending on the babies that are born too early. They're very fragile and can have a sepsis, which is mostly fatal to them. So we are predicting that using the electronic patient file data to make sure that the doctors can act earlier when a sepsis infection happens. Well, these were our AI for Health challenges, and we are working on many other projects to educate the community, such as lunch lectures, master classes, a conference on the 20th of May, a challenge day where people brainstorm about what kind of challenges there are that we can work on as a community. AI for high schools to not only educate the people that have AI accessible to them, but also high schools and other important people. And AI for Health challenges, which I've talked about mainly. So if you're inspired by this work and you would like to discuss on possibilities to work together to solve a challenge within a company, we are happy to connect with you and discuss this. You can find our information here. And with that, I hope everybody stays healthy and was inspired today about artificial intelligence in the healthcare sector.
Thanks, Malou. Thanks. An open invite for those who want to join Fruitbench on solving those health challenges. While we are going to switch to the round table, we quickly have an intermediate slide where we do some logistics, and I would like to invite everyone back at stage again. Malou, you can take here. Bas, David, maybe. Okay, it seems that the technology seems to work. I'm going to quickly scroll through the questions. We're all seated, so thanks for joining again. I really appreciated your presentations. I'm truly inspired about, let's call it, the energy and passion that lives around AI health in our ecosystem. The first question that I would like to open with is something that's dearly to our heart is industrialize the adoption of AI in region Brainport. We have seen that even from young education, child between 10 and 13, it's very important to start adopting technology. I'm curious about your background. Are you really doctors? Are you data scientists? Let's start with Marlou. So you are just studying at the Eindhoven University. What's your background? What's your passion around bringing health and AI together?
Yeah, so I'm still a student. I finished my bachelor's in biomedical engineering. And I've done it at the Technical University of Eindhoven. It was very interesting to me to see what technology could, how it could accelerate the healthcare sector. And for me, my interest has always been in programming, and because it's such an efficient way to use data. So that's why I'm also going to do a master in data science and artificial intelligence, and I hope to have my background as of biomedical engineering to apply it still.
And how do you keep that biomedical engineering then relevant while going into the dark corridors of data science? I think it's still being anticipated as a lot of coffee, no lights in a room, and working on fancy algorithms. Yeah,
that's going to be a real challenge, I think. I think I have such a diverse background now, and there's so many opportunities to learn from. So I really like to code myself, but I also really like to, as I'm doing with Fruit Punch right now, to really define what the actual problem is and talk with people to make sure that we are working on the right thing. And that's what really interests me about Fruit Punch right now. So I hope to be able to do that in my future as well, to stay connected to people still and
make a true impact to human health.
Merge my interests.
Yeah, thanks. Martijn, I'm very curious about your view on the impact of AI and your education, your background, because your way of presenting today was very, you got the message across, right, I think, to the audience. But what was your background while studying?
I hope everybody can hear me. I'm actually an economist. I've studied resource economics. So I've done my bachelor's and my master's in resource economics, and I've started my PhD in resource economics. But economics can be quite diverse data-wise. So I've done a lot of econometrics, statistics, advanced statistics. And I started my career as a researcher in Australia, where I worked on the Great Barrier Reef, trying to improve water quality and using a multitude of stakeholders and data layers to inform decision makers. So I've done a data-driven way to inform decision. So mathematical optimization has always been part of my studies. So yeah, and I still do that. And although I'm a resource economist working in environmental issues to start with, as a company, Gimmicks, we do a lot of research into the medical domain. Yeah. And that is because it's intrinsically motivating. We like to provide the knowledge that we do in commercial products to do that in research and development. So we do a lot of subsidy projects in the Netherlands with hospitals and other medical professionals. Yeah.
It's interesting what triggers me about managing your stakeholders and the decision makers while working in Australia, what I understood, right, in the Big Barrier Reef. My question is, so looking into social barriers of adoption, I think the opportunity that we have at hand is large. So what's in your field the biggest hurdle to overcome by applying AI into the field?
It's a very good question. To be honest, I think the whole process of AI needs to be understood. Once we trust the process of AI, then we can start to trust AI and adopt AI. And when I say the process of AI, I'm referring to what data do we use to train our models? What models do we choose? The data has to be balanced. It has to be a trustworthy source. We need to make sure that there's no bias in the data. So the whole process of starting from a business or a research question, translating that into an analytical question, and then looking for the data sources and the types of models that we're going to use to deal with that data, that whole process needs to be very well managed.
And one way of dealing with that, especially in the medical field, is by adhering to certification.
Yeah.
I mean, especially the one I mentioned,
Quality.
the ISO 13485, it really focuses on what are the risks involved in medical projects and how can we mitigate these risks. And you do that with all your stakeholders. And that is one way of making sure that you do a trustworthy project, and then the stakeholders involved can really start adopting.
Thanks. And I'm very curious, Koen, on your view on it, because your data is being generated into the, let's call it the room of where the doctor and the patient is talking to each other. How do you look into potential biases of the individual who are being interviewed or being said by translating it into usable data?
Yeah, I think data is for sure for us the most important asset, but also like 80% of our focus is on making sure that data is safe as well, and that we manage it in the right way, because it's something very serious. People trust you with that kind of data, a private conversation with your doctor.
Yeah.
We haven't at the moment really focused so much on bias in the data. I think because we're also too small yet, or like the volume of data is not big enough to really get that out. But yeah, definitely we also work on the same ISO certification. So I got your last slide when I started. I was a bit jealous of all the logos you already have, because it's a lot of work to get that right as a small company, but it's really crucial.
Yeah. We tend to see the industry standard applying more bodies, we're getting more certifications in place to guarantee safety or correctness or anything that we need to apply to going forward. That becomes very critical. We got a question from Jannie van Laag for Bas and David. Do you intend to develop the respiratory equipment for the beginning or malignant problems? I'm not a doctor, so I'm going to hope that you can answer the questions. What is your aim to develop this only for doctors or use it by patients independently?
Shall I try this one? So first of all, the algorithms are in the development phase. So we are really testing out whether we can do this. So focusing on the asynchrony case that was presented, we showed that this is possible to begin with. The cases are based on talks with ICU doctors currently. So we do this for big hospitals in the Netherlands based on feedback from the doctors that they would like to have an indication whether there's asynchrony going on. We have not focused this on home use or individual use. I think that's also related to your earlier questions important, is that there's a huge range in where you can apply machine learning or AI in MedTech. It can be from our controller that Bas presented, which is something we fix and then ship out the equipment. There is no AI running in the system at all after that. To really individual use by a patient, which is high risk because it's not a specialist. It can be from what you said repeatedly, Martijn, it can be only indicators to the doctor and the doctor still decides, where in your final slide the loop is closed without even the smartphone in the loop. I saw that, right? Yeah. And that is, so that I think it's important to realize when you talk about AI in MedTech, where you are in that, let's say, range of possibilities before you worry, or maybe you should worry more. Yeah. But I see currently lots of discussions putting this all in one big pile. And there's a big difference, I think, in risk. And also, even if you work on the ISO certifications, we do this as well, that is typically where the discussion ends up. Which risk do you really take? But to be short, not for home use yet.
Not yet.
No.
Yeah. Thanks. What triggers me is not for home use yet, and I think also Quirine positions that digital transformation, not in the field of the enterprises, but also from, let's call it, your personal life. Decision support, decision automation. I saw a big time frame between decision support, hey listen, the doctors can decide, and then decision automation where the amplified feedback loops help you to take the decision. How long do we think about that? What's the future outlook until we are able or allowed to, and I'm curious about your answer, on decision automation in the field of AI for health?
I'm not sure whom you're looking
Martijn, no, sorry.
Yeah.
Oh, you're asking me. Yeah, because it was your slide. Sorry. Yeah.
I can't put a timestamp on it. It's like we're discussing now. It's all about trust. It's all about making sure that we follow the right processes of gathering data. We need to make sure that we monitor our AI decisions properly, that we keep checking them. I mean, the world changes, so data changes, so all algorithms will change, models will change. So it's, I will not put a timestamp on it. but I think we're slowly moving towards a world where we can learn how we can trust AI. And I think that's the main issue here.
If I may add, the ladder that you actually sketch also helps with that. So if you have enough experience on the first thread of this ladder, then you go to the next with confidence, because you've showed that that the AI works reliably on the level below, let's say. So it's not just a roadmap; it's also a stepping stone for each level.
Yeah, definitely a stepped approach, and to add to that, involve all stakeholders all the time.
Yeah,
it's very important. So even the patient, especially the patient, maybe. All stakeholders, yeah.
Thanks. What I'm curious about, Quirine, so Brainport Development is organizing these sessions. How do you look into, let's call it, developing that roadmap and overcoming those barriers and Brainport development themselves?
Yeah, as I said, we've interviewed a lot of MedTech companies in Brainport, and we asked them what are your challenges and what are you working up against. And one of the things I think you're always saying is just gathering the data as one of the basic rules to start even with AI, and a lot of companies also said that they do not know how to start. So I think for all health or MedTech companies, AI will be relevant, but they do not know how to get into the first step. So that's one of the goals of these sessions, starting from today, but also from our next session about data, will be about how to come from one step to another, how to develop a roadmap for AI for all health and MedTech companies in our region. So I was also thinking about what advice you could give to these companies who are watching today to start even with the first step, because I think the challenge is about gathering data, and the next session will also be about this, and we are developing a roadmap, as you said, together with these companies to see how they can get from one step to another. But what advice can you give them, or what questions can we ask them during the next session about data to even start in the first place? Marlou, you maybe want to answer this one?
Yeah, I think as Martijn said, it's really important to involve all the stakeholders, but also if you, as a company, you see that you have, that there's all these technologies that are being developed and you don't know where to start, just reach out. That's especially what we also want to do with FruitBench AI for Health. We give a free solution. We try to make a best solution for them, so just that they can start out somewhere and see what artificial intelligence can bring to them. So that would maybe be a first good step. And I think it's really about just communicating and connecting to the right people. And I mean, nobody really knows how the implementation is going to go, so we should just talk about it and have these kind of events to find out.
Yes. And Koen, I was also curious about your opinion on this, because starting from zero and getting also into the hospital areas to gather this data, how did you experience this?
Yeah, we were very lucky because we didn't start from zero. It was the hospital who started it and then came to us, my previous company, before we spun out Autoscriber. But what I learned is that what's kind of a big opportunity, I think, especially in hospitals, is that physicians themselves, they have a lot of decision power in what they do if they want to do a project with AI. So if you can find a physician that's very interested in it and wants to spend his time or her time, that for us is at least, we see by far the most important. It doesn't really matter if the CIO of a hospital likes the solution or even the CEO of the hospital. It really is about finding one or two doctors who really like it, because those are the ones that are going to collect the data and going to give you the short feedback cycle. And we're lucky very lucky with LUMC, because it's a very fun and smart doctor.
Yeah, I think to all the companies or people that are watching that are not so lucky getting into these hospitals, please reach out to us, because, as I said, we are organizing these sessions with the hospitals in this region. So we have connections there. So please reach out to us if you are getting onto a wall or getting in to the hospitals is a problem for you. So we can do this together.
What I especially liked about your story, Bas, is you came from the mechatronic, mechanical engineering, where you talk about the non-existence of AI initially into the systems, then it starts from scratch, starts learning, starts optimizing the system itself. So could you a little bit explain how you bring the world of mechanical engineering and data together?
Yeah, that's a nice question. That's actually a challenge that we see daily. Yeah? So we have make a lot of mechatronic, various kind of project mechatronics systems, and of course within Demcon we have a lot of experience in there. And I think the opportunity that we have there is to show the way it can also be done with machine learning. So we have very good experts in control engineering. So if you have a control engineering problem, if you have a hammer, you want to hit the nail, right? So, traditionally we always approach this from the traditional approach. The opportunity I have is to show actually that can also be done in a different way. Yeah. And the benefits of that. And that could either be just the control engineering time, so really how much effort our system engineers have to put in solving the issue, but also in that the solution can actually be an improvement with respect to what they would otherwise make. So I think use cases like I showed really help in also showing the rest of the company that this is possible, and also to bring it to new customers.
Yeah. What I especially like about your story about the company is 30 years old. It makes respiratory devices already for quite a while. They're optimizing it. I think a lot of companies are struggling from how to move from that, let's call it classical, no, I don't call it technology engineering, into adopting artificial intelligence. Malou, you talked about multidisciplinary teams. So how does it look into your organization, David? Yeah? How did you make that movement into data science and then bringing it together?
Yeah, that's still a journey we're on. So let's start with that. So one of the important things is what I said with the 3 circles, right? Keep involving this domain expert. Without this person, whether it's a doctor or somebody else, the data science project is deemed to fail, I guess. The other thing is allow people to play around with the topic. So we are an engineering firm. We have about 500 people, mainly PhDs or Master of Science level. These people are more than happy to try this out, but they have to have the opportunity. So for example, what we have is an internal course on AI, where people get to know the basics, know the terminology, know the advantages and disadvantages, see all our use cases. We have 11 sites, so not everybody gets to see everybody's projects. And we do this regularly to make sure people get to know their colleagues' challenges. And if they want to play around with this, we have internal opportunities for that as well. And that way people get to recognize opportunities for AI. What we do not want is that people pitch AI wherever they can. It's not always the solution, but we have to really allow these 500 engineers to get to know the topic. Yeah. And of course we hire, like everybody, we hire specialists as well to help these people when they actually want to apply this in their project. And those are the key technologies we have over the sites. But this program of education is still going on. Yep. And that is key. If we wouldn't have done that, if we don't do that, then you only have 5 or 10 people shouting in the desert, as you would say in Dutch.
Yeah. One thing that I noticed on your story is that the talent squeeze, and I'm going to mention it. I think it's very well known in this industry about technologists and data scientists. Any advice towards the viewers on, because you say domain expertise, and you develop your domain experts with augmenting it with artificial intelligence. I also see the other way around, where we have data scientists with limited domain knowledge. What's your take on developing and attracting the right talent?
Yeah, exactly your sentence. Don't be afraid to develop the talent as well. Yeah. So there is talent available. It's quite new. So people graduating now, certain universities a little while ago as well, but for example, the specific master at Eindhoven University is only starting next year. Yeah. So don't be afraid to develop this talent as well. If you have people who want to learn the topics, they should be fine. And also be aware of the different roles that you have to have in-house to do AI. So not only focus on the data scientist that everybody knows, but please focus on the MLOps roles as well, the software people that you need to implement this. So develop your talent, and if you can't really hire the talent, then cooperate. Find another company. People also have sometimes have problems really allocating these people for a while. So cooperating together. I just came from a meeting this morning where we do that to discuss if you have a little bit of time available, could we work on this jointly? I think that's also important. There is, on technology level, a lot that you can share without actually violating NDAs.
Right, thanks. So Quirine, how do you look to that ecosystem, I think, that's been introduced by David, where he says, hey, listen, we have collaboration groups, parties. What do you feel the role of the AI Innovation Center and the Brainport Development Eindhoven is bringing a lot of opportunity towards the field?
I think a nice case that we view today from Martijn and both of you from DEMCON is that you already work together. So I think a lot of cases will be in collaboration together. I think when you ask for our role, it's connecting these parties together, because I think it's not very common that you meet each other on let's say in this time actually meetings, but that's why the last session we want to organize is also connecting the AI companies to the MedTech companies. So that's why we're going step by step, and the last meeting will be a matchmaking event. From the Brainport AI Hub, we are also building up a community of AI companies. So not only AI companies specifically for MedTech, but also in other fields. And I think our role is to connect these parties together and facilitate moments that they can talk about specific questions, cases, to see if they can collaborate the way you are, David, actually explaining this. So our role is to connect these parties. And actually, we are inviting everyone also to join this and bring in their own expertise to see where we can go in collaboration between these two.
Yeah. Great. We are moving into the final end of this, let's call it webinar. I wanted to make a final round towards the, let's call it the, first of all, thank you for joining. I'm very impressed by what the whole ecosystem is doing. But Marlou, if you want to do an invite towards the audience or one thing to give away, what would be your 2 sentences?
Very big question. I would say don't be afraid to make mistakes and reach out, but that's mainly also because I have the vision from a student still, so I'm allowed to do that. But I really think that, like also was mentioned, you're developing your knowledge in like a safe environment and doing it in kind of a playful way, besides all the legal projects. That's really important to keep inspiring yourself and to grow your knowledge.
Thanks. Bas?
Yeah, maybe just a little bit of a technical perspective, but I think when I speak to people about AI and machine learning, it often involves the algorithms themselves, but I think it's good to know, and the problem is broader, and I think this was well explained. It goes even to stakeholders, but even just within the technology, I think most of the work will either be on the front end, getting the data right, or on the back end, something we discussed, getting it into our edge devices, so really embedding it. I think the majority of the work is there, and the best part, the machine learning part, is still a part of it, but just a small part. So yeah, be aware of that. That will be my message.
Thanks.
Right, yeah, I would say 2 things. First of all, same as you, play around. Don't be afraid to try it out. There's many tools in the online that you can use to get a feeling for what it can do. And maybe most importantly, in my experience, don't get stuck in the general discussions. So try to focus on use cases and keep doing that until you find them. If you don't find them, please do not write too many general PowerPoint slides about what AI can do without having the use case in mind.
Thanks. I can understand where you get allergic from all those big PowerPoint slides.
Exactly.
Exactly.
Especially if they're online. Yeah.
Koen, aanhouderscriber.
Yeah, it depends a bit who the audience is, but I assume now the audience is mostly made up of people that don't directly code themselves. And what I would really recommend is to do at least like one kind of course to understand what a neural network is, because it's actually really easy. AI sounds way more complex than it is, but by understanding that basic function of a neural network, you will be in a position to kind of cut the crap in the PowerPoint slides from the real use cases yourself, and I think that's a really valuable asset to have.
So it's not magic.
Sorry?
It's not magic.
No, it's not magic at all. It's actually, I switched a bit more to software development because in a way I find the AI side not always the most interesting, because it's applying a standard algorithm on data, and that is quite repetitive. The problem you're solving is very interesting, but the actual technique is often quite simple.
Yeah.
Of course, there's guys that come up with these algorithms and they are very brilliant, but yeah, most problems don't need that kind of advanced algorithm. It needs good data, good business understanding, and that's it.
And then the applied use case, what I get.
Yeah.
Martijn.
I would say be thorough. If AI is the answer to, is the solution to answering the question, if it is, then you need to be thorough about all the aspects around AI. I mean, AI is only the intelligence in the middle, but there's so much around it. I mean, I've heard software development, but there's also ethics, there's privacy, security, there's legal aspects, there's regulations. There's so many aspects surrounding AI, and it's good to be thorough, as in be wary of what you're trying to achieve. And that's the only way you can actually get a good product out there.
Thanks. Good feedback. I want to move to closure, if you're okay, Corinne.
Yes.
So what I think from the last few minutes, that the field of AI is rather extensive. I don't want to call it complex, but it's extensive. You need to be thorough, as I want to get back. So the AI Innovation Center, but also Brainport Development, has started a community on AI. That means that we have a circle on ethics, we have a circle on machine learning, we have digital transformation and deep learning. It's a broad, plural of all kind of topics that we need to focus on to be successful in this mission to industrialize AI in the region of Brainport. I would like to invite you to join our circles, our community, to help us and to help yourself on extending your knowledge, meet great people that are on stage today, and even a broader perspective on mutual interest around topics like ethics, machine learning, deep learning, mechanical engineering. Thanks, Bas. It's close to my heart, and therefore I would like to say thank you for watching. I'm looking forward to work with you in the communities.